The Biden administration will lift travel restriction on 8 southern African countries starting December 31st. Last month, the administration barred nearly all non-U.S. citizens traveling from the southern part of Africa because of concerns of the Omicron variant. Officials say reversing the decision comes at the recommendation from the CDC after the pause gave them time to better understand Omicron. Meanwhile, the CDC is shortening the isolation time for healthcare workers who test positive for COVID-19 from 10 days to 7. The decision was made because of concerns Omicron could worsen staffing shortages at hospitals nationwide. The CDC says infected workers who are asymptomatic can return to work after 7 days with a negative test. It added that employees could further reduce the isolation period if there are staffing shortages. And joining us with more is Dr. Amesh Adalja. He's an infectious disease expert and a senior scholar at the Johns Hopkins University Bloomberg School of Public Health. Thank you so much, Doctor. I'd like to start with the CDC shortening isolation time for healthcare workers. How did officials determine it was safe to shorten those guidelines? And do you see the 7-day guideline being extended to everyone else?
The way that this decision was made was based on the fact that we know that 10-day isolation period is a one-size-fits-all recommendation, and that there were people that were contagious for a shorter period of time. That especially became apparent when we were studying breakthrough infections and realizing there was a really truncated infectious period. And so that's why that adaptation occurred to the guidance, because what we know is that people are not necessarily going to be contagious for that whole 10-day period. And hospitals are really worried about staffing and shortages, even though there's going to be mild breakthrough infections. If those individuals that work at the hospital have to be isolated for 10 days, that's extremely hard for a hospital to cope with. So using the data on contagiousness, they truncated this period. And I think it's something that should be adapted to the general public as well, because they also have major disruptions from these mild breakthrough infections. And I think we have rapid tests, so we could actually tailor isolation period based on a person's contagiousness, saying if you're negative on these rapid tests, you can end your isolation. And I think that's the increasingly the norm that we want to sort of instill. And hopefully the CDC guidance will catch up with what the science is actually showing.
The Washington Post is reporting Omicron doesn't have the same some of the distinct telltale symptoms of COVID like previous variants, making it harder for a person to tell if they have COVID, the flu, or a common cold. Now that Omicron is the dominant strain in the U.S., how do we revise what we know about COVID, especially now that we're in cold and flu season?
It's going to be extremely difficult to distinguish between other common cold-causing viruses, influenza, and COVID-19, because there's such an overlap in symptoms. And early on, we were using loss of taste and smell as a way to kind of differentiate whether you had COVID-19 or some other respiratory virus, because it was very specific. But we're finding with the Omicron variant, loss of taste and smell is not very common, and it's probably even less common in people who are fully vaccinated. So this is why testing becomes critical, that when you think you have symptoms that are consistent with the common cold, you should get a test. And if you're negative, maybe you also could be tested for influenza, because that's a totally different treatment pathway, and we don't want to miss flu cases as well. So this really emphasizes the need for quick diagnostic testing for both COVID-19 and for flu. And hopefully we get more supply of these home tests, because that's going to be critical as we move through the next phase of this pandemic.
So not only are we not in cold, or are we in cold and flu season, it's also Christmas Eve. What do people need to keep in mind when traveling and gathering with loved ones over the next 2 weekends?
If you're somebody that's fully vaccinated, you can basically go about your life knowing that you're free from the risk of severe disease, hospitalization, and death, because your vaccine is going to protect you from those important consequences. But you have to realize that Omicron is an ever-present virus. You're going to encounter it likely at some point in time, and this is not something that can be completely avoided. So we've got to learn to be able to accept that risk and to calculate around it. And using home tests, like I said, being vaccinated, that's all going to be very important. If you're unvaccinated, you're on a totally different track, especially if you have high-risk conditions, because then you run the risk of getting a severe case and needing hospitalization, needing treatment in hospitals that are already being stressed with the Delta patients that we've had for the past several months. So I think that's the best way to think about it is, are you vaccinated? Are you not vaccinated? What is your personal risk tolerance? And then kind of being judicious about what you want to do based on your own preferences.
Definitely want to be careful. Dr. Amesh Adalja, thank you.
Thanks.